Welcome to Laugh Through It All. I'm your host, Tracy. Join me as I sit down with board certified urologist and sexual medicine expert to answer the questions men want to ask but usually don't. We're diving into everything from testosterone and ED to porn, fertility, libido, and how sex really changes after 40. Such an important episode. What are the most common sexual health issues that men over 40 face?
Oh, goodness. So, this is a really great question because men usually don't go to the doctor, right? So, they don't know what's going on. And so, I'd say erectile dysfunction is one of the most common. So, 40% of men in their 40s have erectile dysfunction,
Wow.
50% of men in their 50s, 60% of men in their 60s. And you see a pattern here, right?
Yeah.
And this is because most of the time people have other comorbidities and other issues going on that lead to erectile dysfunction. So some of the most common sexual health issues: low libido, like low sex drive, low testosterone or hypogonadism, erectile dysfunction. And then as you get on a little further out, you have ejaculatory dysfunctions. And those can be anything from premature ejaculation, like you come too quick,
Yeah.
to delayed orgasm or delayed ejaculation, where they're trying and they're keep going, and it's just not happening, or it's taking a really long time to happen. So these are probably the most common sexual health issues that guys come into my office. I'm leaving one out. I'm recognizing Peyronie's disease. Peyronie's disease is where when men get an erection, they get a curvature or a bend in the penis. And this can come on abruptly, like they literally can wake up one morning and all of a sudden their body does not look the same. Or it can be something that, kind of happens gradually as a result of a trauma or an injury or something like that.
Because a broken penis is a real thing.
Oh, for real, for real. Now, we don't actually have a bone in the penis, but what happens is the tunica or the corpora rupture. And it usually occurs when a man has a rigid erection. It's most commonly occurs during sexual activity, either, female on top or man from behind, doggy style.
Mhm.
But what happens is you slip out and you either hit the pubic bone or you hit the pelvis and it bends and you get this tear, this tunical tear. And what happens is, or corporal tear, depending on how bad it can be. And some people can even, it can be so bad that you tear your urethra, your urine channel, where you pee. So that's a medical emergency. Usually, guys have immediate pain. Usually, they have immediate loss of the erection. And you really should go to the ER. Even though that can be quite embarrassing, you should definitely go to the ER. Now,
So, but can it be to where it hurts for right now, and but there is complete damage, and people don't go to the hospital?
so depending on how young and healthy someone is and how bad the tear is or the penile fracture, some men can recover and be
Okay.
fine. But also, there's good data to show that the longer someone goes without seeing a physician or not getting that corpora repaired, it leads to much higher rates of permanent erectile dysfunction.
Wow. Yeah, I
Yeah.
mean, I've heard that, but you never know if it's if that's actually a real thing or not.
It is true. And, a lot of guys don't go because they're embarrassed, right? Like they don't want to
Sure.
show up in the middle of the night in the ER and their penis is black and blue. But it really is important because it's something that can lead to permanent erectile dysfunction. And if God forbid they had, a tear of the urethra as well, it can lead
Mm.
to urethral strictures, urinary issues, blockage, retention, a lot of other stuff too.
So you talked about not being able to to orgasm. Now, because you can stay erect but not have an orgasm, and they have the feel because I've had this experience where people are like I just can't. I need to, be comfortable, or I need to be more comfortable. It's like, okay, so what is that a lie? Like, are do because if they have an erection, do they just need to be comfortable with someone to orgasm, or is it really a medical problem and they just don't realize it?
So it can be both. It can be both. So the most common causes of anejaculation or delayed orgasm or inability to orgasm or ejaculate, there's usually five main causes. Number one can be low testosterone. So if a man has a total testosterone level below 150, most of the time that's so low a man can't even orgasm or ejaculate. So low testosterone hormone levels can check it. Idiosyncratic masturbation or hyperstimulation. So this is when someone has very frequent masturbation or they use something, whether it's a very tight hand grip or satin sheets or some kind of force pressure that cannot be replicated anally or vaginally,
Hmm.
that can lead to an inability when they're with their partner. Um, nerve penile sensation loss. So penile sensation loss, that can occur with terribly or poorly controlled diabetes, spinal cord injuries, things like that. Nerve dysfunction as well, like people that have had a radical prostatectomy. So when we do a radical prostatectomy for someone that maybe has prostate cancer, we remove the prostate and the seminal vesicles. And those are the two main organs responsible for ejaculate volume. So when you have a radical prostatectomy, or even in men that undergo radiation therapy, it's still, after surgery, it happens immediately, but after radiation, it usually occurs in about 85% of men by 5 years. What's happened is we damage or remove those organs, and so you no longer are able to ejaculate. Now, that doesn't mean that a man can't still get a great orgasm and feel pleasure and feel good. They just won't have fluid come out of the penis at the same time, so they won't ejaculate. So we have testosterone levels, we have idiosyncratic masturbation or hyperstimulation, penile sensation changes or nerve changes, medications. So
Mm.
some men may be on a medication like Flomax. Those are alpha blockers that are oftentimes prescribed for an enlarged prostate, and those can cause ejaculate to actually go backwards or retrograde. So they may have an orgasm, but they don't see fluid come out. There's also medications like SSRIs or selective serotonin reuptake inhibitors. These are medications that are most commonly prescribed for, say, anxiety or depression. And
Yes.
one of the side effects of those medications is that they can delay or prolong ejaculation and orgasm. So it's funny because we use those to treat premature ejaculation because of the side effects. And then psychogenic, like you mentioned. Maybe it's your first time back intimate with someone after you've been widowed, or you're
Yes.
divorced and you're in a brand new relationship, or maybe you're in a relationship that's very emasculating, or there's a lot of stress, there's a lot of tension, or maybe your head is in another place, right? You have a family member who's ill, or you're stressed and tired from work, or tons of little kids that you're running around taking care of. All those things, just like women, can get in your head, and you just can't get there. So, I always tell people these are kind of like the five main things that you always want to check and take care of and make sure that you're looking into. And if all of the other four are ruled out, then we assume that it's usually something psychogenic or adrenaline mediated, maybe. And we usually will refer to a sexual counselor or a sexual or mental therapist that can really help get down to the root of it. And also bring the partner in, because again, it's a couple issue 9 times out of 10 in that case.
Because I find it odd that you like say if they're in their head and it's mental that they can still get an erection though. You think it would be the opposite. I
Yeah,
think
yeah.
the opposite. You
And
think
some
they
men
wouldn't be
will.
able to get an erection.
Yeah, and that's also what can occur. A lot of men will have trouble with erections,
Yeah.
as well with psychogenic ED. And one of the biggest key kind of questions I ask patients when they come see me in the office to try to decipher that and rule that out is I'll say, when you're by yourself with self stimulation or masturbation, are you able to get a good erection? And if you can get a great erection that you can maintain and sustain by yourself, but you can't with your partner, then that lets us know there's some other dynamics going on.
Okay. Some other
It really
dynamics.
works.
What's that?
The machinery works. We just
Right.
have something else going on. Yeah.
Okay. So even with no orgasm, but they can do it themselves with masturbation. Same thing is that wouldn't be health. That would be mental.
If someone is able to orgasm and ejaculate by themselves with self-stimulation or masturbation, but they are not able to do that with a partner, then there is something psychological, psychogenic going on, usually with their partner in them. And so
Okay.
those cases is really well a sexual counselor or a mental health counselor that specializes in relationships and can really be very beneficial.
Okay. And then you talked about testosterone. So testosterone that really does affect not only performance but desire.
100%. So, testosterone is a natural hormone that both men and women have. Natural levels in a man is anywhere between 300 and say 1,000. In women, we're about a tenth of that. 1/10 of that is our normal levels. So, testosterone is not just the sex hormone, but it is the primary mediator of libido or sex drive in men. You also need to have a certain level of testosterone in the body in order to be able to get and achieve an erection. Now, a lot of times guys will come see me and they're like, I need to get more T because I need to help with my erections. And I have to kind of clarify that testosterone is not a treatment for ED. However, it is a primary hormone that is, you need at least certain normal levels of testosterone in order to get an erection. So testosterone is the most primary mediator for low libido or sex drive. It also, though, is really, really important for not only that, but your motivation, your energy levels, your concentration. Low testosterone can actually predispose to osteoporosis or brittle bones. It can predispose to cardiac disease or stroke. It can predispose to diabetes, metabolic syndrome, and so many issues that can actually kill us, right, when left untreated. So, oftentimes, low testosterone, I think, is so important. And I think that it's something that really, at some point in time, I hope will be something that is regularly checked at your annual exams, just like your lipids, your blood pressure, your cholesterol, your sugars. We should be checking testosterone levels.
Because I'm sure you go to your doctor, and if I just think of some regular old macho man, and the doctor says, how's your sex drive, things like that. Oh, fine, just a pride thing.
Yeah,
You
no,
know, where
absolutely.
yeah, where if they put it in like you said, put it in with a typical physical and tested for it, they could say, "Ooh, let's take a look at this."
No, absolutely, because it's not, sometimes people say, "Oh, it's just part of getting old or it's just part of aging." That's actually not true. Testosterone and erections are a good marker of someone's overall health. So if you have low testosterone, we want to find out why. Why do you have low testosterone? Is it because you're obese? Is it because, you've had chemotherapy or radiation history? Like you start looking for causes. Do you have obstructive sleep apnea? Are you snoring at night? All of
Mm,
these things can contribute to low testosterone levels in men.
sleep apnea does.
Absolutely. So
Wow.
testosterone is diurnal. So it's highest in the morning and it declines throughout the day because we're supposed to be tired by nighttime and to help us sleep and rest. But your testosterone levels are replenished overnight during your deep sleep and your REM, and that's when it gets replenished. So if you're not getting good sleep and you're constantly having these apneic episodes that are causing you to wake up or not get
Yes.
rested sleep, then your testosterone levels are going to be low. But even in addition to this, it's going to predispose you if you're not wearing a CPAP and treating your obstructive sleep apnea. It's going to predispose you to pulmonary hypertension that can lead to stroke, and that's even in young, healthy guys.
Yeah, that's scary.
Yeah,
So what would be some of the side effects besides low libido? What else should someone be looking for to where they'd be like, "Oh my gosh, my testosterone, I better have it checked."
absolutely. So testosterone symptoms and signs are multifactorial. So it can be related to a lot of different things, but you see mental kind of physical cognitive symptoms. So you can see decreased energy, fatigue, inability to concentrate, depression, um, emotional lability. You find yourself being more emotional, easily able to cry, to get tearful. You can see decreased lean muscle mass. You can see decreased strength, decreased endurance, not able to lift the same, not able to work out the same. You get really tired walking across the parking lot where you didn't used to. And then you can also, when it's very low, they get symptoms just like you see with women with genital urinary syndrome and menopause. They can get hot flashes, they can get night sweats.
Oh,
And when it's very low, absolutely. We see this very commonly in men that are prescribed something called androgen deprivation therapy or ADT. This is usually a medication given when men have prostate cancer that's severe and they need to be on it as well. In addition to that, as I mentioned, you do get the low libido and you may see erectile dysfunction as well.
and when should someone get theirs checked? I mean, should they get it checked if they're feeling fine?
So like I said, I think it's a good marker, and we
Yeah.
know already that it's a marker of overall health, and that low testosterone can predispose to cardiovascular disease, diabetes, osteoporosis. So I think it should be checked annually. I think we did a. I was about to say I think it should probably be checked around 40 and up, but we even did a study at our own institution in our practice, my men's health practice, of just young men who were coming to see me for infertility. So this is guys 45 and under that, as young as in their early 20s. And we checked testosterone panels and we checked lipid profiles. And we actually found that over a third of all young men coming to see me for infertility who or otherwise healthy guys had two or more cardiovascular risk factors that were undiagnosed. So they either had hypertension, they had diabetes, they were tobacco smokers, they had elevated triglycerides, low testosterone. And so, again, maybe it should actually be happening when you're 18. Maybe by
Right.
18, we should be doing annual exams, to kind of go through where your testosterone is, where your cholesterol, where's your blood pressure, where's your hemoglobin A1C, your blood sugar. Because if we catch things early, then we can prevent them, right? Preventative medicine is key. Just like you take your car to get oil changes, preventative health measures are the same thing. They keep your car running, they keep your body running healthy and strong. And most of the time these issues are silent killers, right? You don't feel bad when you have high blood pressure. You don't feel bad when you're smoking cigarettes when you're in your 20s and 30s and you think it's so cool.
Yeah.
You don't realize it's going to lead to ED and bladder cancer and lung cancer and everything else. So, I think the earlier we can get people plugged in, and start getting annual exams and checking it, I think the better. Now, when you get your labs checked, there's one important thing. Number one, by definition, low testosterone is considered a total testosterone level of less than 300. Okay.
Okay.
So, and it has to be drawn early morning, so before 11 a.m., and you need to be fasting.
Passing.
So,
Yep.
early morning is because, again, testosterone is diurnal and it's highest in the mornings and declines throughout the day. So, we want to know what is your best level, because if that's low, then we know it only tanks further throughout the day. And then we get it fasting as well. Now, the guidelines recommend getting 2 sets of labs. So, the American Urological Association, which is our governing board, our guidelines for anyone who's a board certified urologist and urologist in training, recommends getting 2 labs about a week apart, drawn early morning fasting. And if you are below 300, then you are considered hypogonadal or testosterone deficient, low T, and you're a good candidate for testosterone replacement therapies.
Wow. That just blown my mind that, that you said people in their 20s were that was were low.
Absolutely. Absolutely.
And is that what's typically what is the biggest thing when they are fertility issues, it's the men is the level of testosterone.
It can be a range of things too. Fertility and erections are a great overall marker of someone's health.
Okay.
So I always, we talk about it, but in the U.S., like most men don't go to the doctor, right? Men die on average 7 years earlier than women. They die on average of 8 out of the 10 leading causes of death, and it's because men don't get plugged into a doctor, whereas many times women are plugged in early with an OBGYN or
Mhm.
pregnancy, things like that. But so young guys, when they come to see you, oftentimes they may have obesity, right? Obesity, when we have more adipose tissue or fat tissue in our body, we have an enzyme called aromatase, and aromatase converts testosterone to estrogen. So people that have more or greater obesity are going to have lower levels of testosterone, which can also impact fertility. Smoking, tobacco smoking, marijuana smoking, drug
Mm.
use, vaping, e-cigarettes, which everyone thinks is safer somehow for some reason,
Yeah.
which is not. All of those lower sperm counts, they lower sperm motility, they lower sperm morphology or shape. If you're a very heavy drinker, you are
Mm.
going to have poor fertility. Imagine like the more you drink, the more drunk your sperm is. They can't swim, they can't move, they don't know what they're doing. We even see, and it's scary, and surprisingly, but we even see there's good data that shows in parents, so in males who drink, even their offspring have higher rates of birth defects and issues growing up in development, just because even the paternal, the husband drinks, heavy drinkers, even if the wife,
Ah.
the mom isn't drinking anything. It's so many different things that can cause that. If someone has a history of exposure to chemotherapy or radiation, that can damage your testicles and damage testosterone production as well as fertility. If you have diabetes is just awful for everything when it's poorly controlled and not well. High blood pressure, high cholesterol, high triglycerides. All of these things are markers of someone's overall health, and they all impact erections and they all impact fertility in men.
But you can um it is preventable, you said, right?
Yes. Yes. And we see reversibility. So if someone's a very heavy smoker and they're a heavy drinker and they stop smoking and they stop drinking, or they drink in only moderation, we'll see significant increases in testosterone levels. We'll see significant increases in their sperm counts, their sperm motility. Oftentimes, we'll also prescribe something called like fertility supplements. And
Okay.
this is just kind of a mix of different vitamins and minerals that have been shown to decrease free radical oxidation, or DNA fragmentation in men and their sperm. So it optimizes and enhances the sperm and can also increase counts, motility, and shape. So many things are reversible. Losing weight, we know, can increase testosterone levels and also help with fertility. So many things are reversible. Now, there are some conditions for men with fertility where they're not reversible or they're genetic, right? You can have conditions called Klinefelter syndrome, and it's where the man gets an extra X chromosome. So a healthy man is, 46XY, but you get an extra XXY. So it's 47XXY. And that extra X chromosome can lead to fertility issues in men. Or you can have, a deletion on your Y chromosome, something called an AZF Y microdeletion. And that's where, on the Y chromosome in a man, which makes you a man, You have these three subunits, A, B, and C. And those are really like the blueprint that tell your body how to make sperm. And so if you're missing the A or B subunit, your body never got the blueprint or the map telling it how to make sperm, and it can't. If you're missing the C subunit, and some of those men, we can find sperm, but it requires a surgical procedure to get sperm.
Okay. So erectile dysfunction, talking about that, it's not inevitable. Not everybody is going to get it.
No, if you take good care of yourself, if you are healthy, you can. I have 80-year-olds that come see me in clinic that aren't on any medications and they get great erections. And these are just that like protoplasm of man who is healthy. Maybe he was always in athletics or he was a marathon runner and he just always worked out. He never smoked, he never drank, he's healthy. I think kind of when guys come see me, I tell them that there are four pillars of overall health and sexual health. And there is no medication or drug that I can give you that will be stronger than these four pillars. And that is your diet. What are you putting into your mouth? We have good data that shows higher plant-based diets and less red meat are better for not only cancer prevention, but for sexual health and preserving erections. Exercise. I mean, surplus of data. Exercise is
Right.
good, right? Just move your body. And it doesn't mean that you have to do these crazy high intensities, but even 20 minutes a day of walking, 3 times a week has been shown to have improvements. So, diet, exercise, stress mediation, right? Like, how do we handle stress? Because when we're so stressed and worked up, you have increased rates of cortisol in our bodies. And cortisol is inflammatory and it causes all this inflammation in our body, which ages us. And then sleep is probably the biggest thing that no one does. And right, we always kind of make excuses, right? Oh, I got to stay up. I got to get this work done. Or, oh, my kids, when you're younger and you're dealing with getting your kids to sleep. But sleep is so important. It's where our body replenishes. It's where it nourishes. And we really need 7 to 8 hours of sleep. Most people do a night. So those four pillars are probably the most important things you can do for an erection and overall health in general. But no, ED is not inevitable. But the problem is that in the US, especially, the overwhelming majority of people are slightly unhealthy, right?
Sure.
We have this obesity epidemic, we have this diabetic epidemic, we have plastics in our food and microplastics everywhere. We have processed foods, which are just or awful and terrible. I mean, processed meats are like a class two carcinogen. I mean, it's like as
Right.
bad as lead and mercury, and yet it's something that we eat all the time, right? So
We willingly put in our body.
yeah, it's so true. So again, just thinking that, the healthier you are, and if you take good care of yourself and you don't
Mhm.
smoke, are not a heavy drinker, all those things really, you can have good erections. But unfortunately, why we have 50% of men in their 50s, 60% of men in their 60s, 70% of men in their 70s with ED is that as we age, we tend to not take as good care of ourselves. And comorbidities can impact the arteries and the vessels that bring in blood to the penis and cause erectile dysfunction or an inability to maintain or sustain an erection.
And mental health too, especially when it comes to men, they're not as apt to seek out help and get therapy and things like that. So mental health, I would assume, would especially for, that generation is pretty high too.
Gosh, you bring up a really great point that I didn't talk on enough. Mental health is so important. 1 out of 4 men suffer from depression and suicide. Men are more likely to commit suicide. We actually have this wonderful thing called Move for Health or Movember, and it's in November where we really, nationwide, we try to do this really big push for Move for Health. And the Move for Health is promoting men to talk about prostate cancer, testicular cancer, mental health, and gun violence. And, mental health is a huge component of things. Low testosterone can cause depression. Sexual dysfunctions can cause depression. Depression in and of itself can, cause sexual dysfunctions, relationship issues. And so it's really so important. It's mental health is just as important as your physical health, as your overall health. And it's something that we really need to talk about. And if you're feeling sad or you're
Mhm.
having thoughts, again, go see a medical professional, go see a provider, go get help for that because it's common. And some of my patients are like, "Oh, I can deal with it or I can handle it." And I'm sure you can, but like think about it. Like LeBron James got a coach to get better at basketball. Tom
Right.
Brady got a coach to get better at football. If you're in a space where you're having trouble with issues, or you're having trouble with your life or managing, get a coach, get a therapist to help you. Doesn't mean you have to see them forever. Doesn't mean you have to stay on medication forever.
Hmm.
If something allows you to feel better and do better and
Yeah,
enjoy life the way that you want to, why would you not go seek out that resource to help get you where you need to go?
absolutely. Amen. I agree with that 100%. Now, women have hormone replacement therapy. I'm guessing they have something for testosterone replacement therapy.
Absolutely. And some
Okay.
women need and take testosterone, but for men, we do testosterone therapy. There's many different modalities, and it's
Okay.
dependent on the age of the patient, or I should say their fertility desire or status. I shouldn't say age, right? Because there are many older men having children still. But it's dependent on whether fertility is important to you, whether you're around young kids. So there's different drug delivery systems. There's gels, there's oral testosterones, there's injectable testosterones that you inject yourself. There's pellets that are long-acting dissolvable pellets that you get placed every 3 months. There's many different modalities. And then if someone's interested in fertility, you never want to take exogenous or outside testosterone because our body is super smart, right? It's always trying to keep everything in this nice balance, this homeostasis of hormones and levels and everything. And so, if you take outside testosterone, your body recognizes, oh, I have enough testosterone. Great, I'm good. Testicles, we don't need any more right now because it doesn't know where it's getting that testosterone from. So, it will shut down your own testicles' natural testosterone production.
Oh, wow.
Yeah. And the testicles do two things, they make sperm and they
Yeah.
make testosterone. And they can't prevent one or the other, they both get shut down. So, I'm seeing balloons pop up on my head. It's
It's
like,
happened
yes.
before where did you I think you did the peace sign and it did it on another podcast too. It was so funny. She's like, "Why are there balloons?"
I love it. I love it. Celebrate fertility. Um, but the testicles, when you take outside testosterone, your body shuts down your own testicles production of sperm and testosterone, and that can be irreversible at times. I'll have young guys that come in to see me that were feeling tired or low libido, and someone, seemingly in a good-natured manner, started them on testosterone, but didn't ask about fertility. And we actually know that people that have been on testosterone for even 1 year, you see detriments in their sperm counts, and sometimes that can't be reversed. So there are options for people that have low testosterone that are still interested in fertility, and those would be medications like something called Clomid. Clomid is a selective estrogen receptor modulator. It's oftentimes prescribed for women to help with ovulation, but we actually use it off-label for men to stimulate your own body's natural testosterone. It's an estrogen blocker. We have something called HCG. It mimics the human chorionic gonadotrophin that our brain pituitary secretes to tell our testicles to make testosterone. And we also have something called arimidex, which blocks the aromatase that converts testosterone to estrogen. So we have things we can give people that are interested in fertility to increase their testosterone. They just can't take exogenous or outside testosterone, like injections or oral medications or gels or things like that.
I think it's interesting that there's different like fertility or not, if you're not worried about fertility, that's a completely different type. That's interesting.
Now,
That
I do have some, patients of mine that are older and not interested in fertility that love Clomid because it's a pill. It's a pill you take every other day and you don't have to think about it. And it increases your own body's natural testosterone. And a lot of men really like that. And then at some point, if your own body, your testicles burn out, they're just not able to ramp up and produce that testosterone, then you take it outside or exogenous testosterone and get it back up to normal levels.
now you said depending on who you're around, on which kind you're taking, did you say children?
Yeah, so gels, there's testosterone gels, like androgel or other different
Okay.
transdermal gels. The problem with gels is their biggest risk factor is transference, meaning that it's going to transfer onto
Oh,
partners, transfer onto little kids. So there's very strict criteria about how you use these gels if you're going to use gel for testosterone. Because number one, it has to be applied every day. It should be applied at the same time, typically in the mornings. And you need to have clean, dry skin. You put it on your arm, your chest, your back, and then you need to wait 10, 15 minutes to let it fully absorb before you put clothes on, because otherwise it gets absorbed into the cotton or into the shirts. And there's studies on this where they looked at the shirt samples that people put on and there was testosterone in them. And if you're around little kids that you're carrying,
yes.
picking up, or a
Mm.
baby, or a young female and y'all haven't had children yet and you're interested, right? You shouldn't be on it anyway, but you're around, you can transfer that onto your female partner or to young children and actually really mess up their hypogonadal axis.
Wow, that makes so much sense. I'm like, I think that's what she said.
Yeah, yeah, no. So I
Okay.
I ask people about their lifestyle. I ask them, insurance matters too. Different insurance cover carriers won't cover certain things. And then, what they like. Some people are really needle phobic, right? And they're like, oh my God, I could never inject myself. Other
Sure.
people are like, I couldn't remember to take a pill every day. So I love the idea of a once weekly or every 3 months injectable. And so you just kind of go based on what their preference is and take it patient by patient.
Now, people who take Viagra, or is it Cialis? Was that the other kind? Does that treat ED, or is it masking something that should be looked at further?
They're really great questions. So, first line treatment for erectile dysfunction is what's called PDE5 inhibitors or phosphodiesterase 5 inhibitors. That's Viagra, sildenafil, Cialis, tadalafil, Stendra. There's several of them. And what those medications do, in short, is they cause vasodilation. So they increase blood flow and oxygenation into the penis to help a man either maintain or sustain an erection sufficient for penetration. Now, the Princeton 4 criteria is a very important document that comes out. It comes out usually every 10 years, and it's all about cardiovascular health and erectile function. And people have actually found that these PDE5 inhibitors, like Viagra, Cialis, tadalafil, are actually cardioprotective.
Mm,
So a lot of times people take these preventatively in low doses, like daily Cialis or low dose daily sildenafil, that can actually be cardioprotective and help prevent further erectile dysfunction. So
wow.
they're a great first line treatment therapy. And oftentimes guys will say, well, will that like, you know, will I build a tolerance? Like, will I not be able to take this eventually? And actually, no,
Great
you
question.
won't build a tolerance to this medication. It's good for you, it's healthy for you. When the medication stop working or when the pills stop working is usually because the degree of your erectile dysfunction is worsening. And that most commonly is related to worsening comorbidities, chronically poorly treated diabetes, tobacco smoke, high blood pressure, all of those things. So, it's not masking anything by any means, but when you get ED, because we've talked about all these cardiovascular risk factors that cause ED, ED is actually a warning sign or what we call a harbinger for cardiovascular disease. And it
Oh,
can actually precede a heart attack or stroke by 3 to 5 years. So men will develop erectile dysfunction. And that should be a warning sign for you to go see a doctor. Go see a urologist. Go see me. Come see someone who's a sex med, men's health urologist. And get you a complete workup, right? Go get your lipids checked, get your blood work checked, get your hemoglobin A1C checked, your blood pressure. Do an overall preventative health evaluation because when you get things early and you catch them early, you can prevent things from happening later and worsening, right? We can prevent heart attacks if someone gets erectile dysfunction and they come in and we find, oh my gosh, you have, your lipids and your triglycerides are through the roof. And oh my gosh, we ended up taking you to see a cardiologist and you also have diabetes that's, not been diagnosed. So all these different things. And now they get a calcium score that shows them their heart's not doing great. So again, erectile dysfunction should be a good warning sign to go to the doctor, but I wouldn't say that the pills mask anything. The pills actually are a great first line treatment. They can be preventative in a way, but you don't build up a tolerance. Rather, it's the comorbidities itself worsen or the man's overall health worsens.
and there really is no risk for continuing to use them over time.
No, they do have some black box label warning, like you're not supposed to take them if you're
Sure.
taking nitrates, like for angina or chest pain. And if you take something like beta blockers or alpha blockers, something like Flomax for an enlarged prostate, you just should be careful about when you take them and timing and be that. But in general, I have patients that are on nitrates, and I also prescribe them PDE5 inhibitors. And those patients, I'll reach out to their cardiologist and I'll say, "Are you okay with me prescribing this?" And 99% of the time they'll say yes, and we give that to them. The Princeton 4 criteria have two really good guidelines to see whether someone is healthy enough from a cardiovascular standpoint to have sex. And that is if you can walk up 2 flights of stairs without chest pain, or if you can walk a mile on a flat surface in under 20 minutes without chest pain. And if you can do that, then you are metabolically safe and equivalent heart healthy to have sexual activity.
How often does that that just made me think, shows and everything. How often does that happen where people have heart attacks or strokes when they're having sex?
Luckily, it's very, very rare,
Okay.
but it can happen.
And like the medical shows, or these older people come in, and the one lady's like, "Yes, she he had a heart attack while we were having sex."
Yeah. Yes.
So, diabetes and erectile dysfunction. How because I know that's very, very common. So, how can you have diabetes, and is it just the ED medicine, or is there other things that they can do?
You mean, how do we treat like erectile dysfunction in someone that has diabetes, or why does
Yes.
diabetes lead to ED?
I guess either one, because I do know someone who had that issue where they had diabetes, and to get an erection was very difficult. And
So
so, but I don't think this person was treating the erectile dysfunction. But then maybe it's hard. You can't treat this if you've got a certain level of diabetes. I don't know. Maybe you can explain that.
no, 50% of the time, patients with diabetes don't respond well to pills. And that's just because they have worsening erectile dysfunction. They have worsening damage to the veins, the arteries. So, for a man to get a natural erection, you need five things, kind of like we talked a little bit earlier. You need healthy hormone milieu. So, you do need a normal testosterone level. You need healthy nerves, intact nerves. You need healthy arteries, healthy veins, and healthy erectile tissue. Diabetes impacts all of these. Elevated blood sugars hurt all of these over time. So you're really combating it with everything. So that's why when people have poorly controlled diabetes or diabetes for a long period of time, you get such damage to the erectile tissue that pills or PD5 inhibitors, our first line treatment, is oftentimes not responsive. And so many
Mm,
times diabetics end up needing to have penile injections or use a vacuum erection device or get a penile implant in order to be able to have the ability to have a functional erection. Now, if you have well controlled diabetes, right? You have diabetes and you're keeping your hemoglobin A1C below 6, almost like you don't have diabetes, or, just very well controlled, then you oftentimes can mitigate these side effects of erectile dysfunction and, vision problems and peripheral neuropathies and kidney disease and everything else that can occur with diabetes.
okay. Wow. That seems like a penile implant and everything, because that seems so like that's a drastic step, it seems.
So penile implants are really common. They're oftentimes touted as the gold standard for treating men's erections. Typically, they can be discussed at any point in time. But if someone cannot take pills or they're not a good responder to pills, then a penile implant for a lot of guys is a really great option. Again, you should go to someone that's like a high volume implanter like myself. We do about 150, 200 implants a year. And it's usually typically a same day outpatient surgery. It takes about 45 minutes. You go home same day. Depending on the patient, they may go home with a drain. And you're seen back, in about 2 weeks to make sure that you're healing well and that you're doing good. And then you can usually activate your device and start using your penile implant anywhere between 5 and 6 weeks after surgery for most patients. It gives the man the ability to have a natural, spontaneous, rock hard, rigid, hang a towel on it erection whenever they want by just inflating this pump that's hidden in the scrotum. So it's like they have a third testicle. They have a pump
Oh,
that's completely concealed in the scrotum that you pump up, and then saline or salt water fills the implant that's inside the erectile bodies of the penis to give a man a rigid erection. And then it stays erect, unlike a natural erection where once you ejaculate or orgasm, it goes away. It stays erect until you push a button on that pump to make it go down. They really have a very high patient satisfaction rate,
wow.
97% partner satisfaction rate. And
I
they
would guess so.
there's risks with anything we do in medicine. There's risks with putting in
Sure.
a penile implant. The biggest risk is infection because you're putting a prosthetic device in the body, just like knee replacement, hip replacement, penile implant is infection. But you can also have device malfunction. And then, of course, any of the risks that go along with undergoing anesthesia and operating in the body, injury to surrounding vessels, organs, things like that as well. Luckily, those risks are very, very low in high
Sure.
volume implanters, 1 to 2%, but they can happen.
And with the implant, like the ejaculation part, that's all the same?
Absolutely. So, all an implant does is it gives a man the ability to have a natural, functional erection for penetrative intercourse. It does not change penile sensation. It does not change their libido or sex drive, and it does not change ejaculation or orgasm. So, I'll have guys come see me sometimes and they're like, I'm really having a hard time getting an orgasm. I need an implant? I'm like, hold on. This is not going to help you, if you're having issues with an orgasm. Because one of the things that men don't understand too sometimes is that you can still have an orgasm in the absence of an erection. It may require more stimulation, oral sex, or vibratory stimulation, but you can achieve an orgasm in the absence of erections because it's technically three separate processes. I'm holding up four fingers, but it's three separate processes. It's an erection, an ejaculation, and orgasm. And those are three separate things. But we kind of group them together because, you have an erection and then you get
Right.
ejaculation and orgasm and they occur simultaneously. So we think of it as one thing.
Okay. And it doesn't
All,
affect.
all the sex ed you're learning
I
today.
know, I'm learning so much.
I love it. I love it because we live in the US, right? We do a really bad job of normalizing normal
Absolutely.
body functions and normalizing
Absolutely.
sex because sexual health is such an important, as we've discussed, marker
Yeah.
of someone's overall health. And I mean, it's dependent on the procreation and survival of our species, right? So,
Yes.
it's something that's so normal and so natural and such a really important part of relationships and intimacy that it's really something that we should talk about more often so that people know what's normal, what's not normal, when should I see someone, and to give people better tools for discussing this, right? With your partner, discussing it with a doctor, all of those things.
Because so many people in so many relationships are they're not having sex, and they're not talking about why. And I've done plenty of podcasts, with sex therapists and things like that, and women, how women didn't have a voice before and can't. We've spent a lifetime faking it just to make the
Yeah,
other.
the orgasm gap.
Yeah, just making sure they feel good. And it's like, well, shit, what about us? No.
100%,
Yes.
100%. Don't fake it.
No, that's I've said it. I said, "Don't do it." There's such a lack of communication, and it's so terrible that people are in these, decades and decades relationship, and, God, they probably have never been fulfilled.
Exactly, exactly. And oftentimes women think something's wrong with them, right? They
Yes,
think, like, I'm
yes,
broken, like, what's wrong with me? I can't have an orgasm. And what they don't understand is that 85% of women don't orgasm with penetration alone. They need clitoral stimulation. A lot of
yes.
women get older and you hit genitourinary syndrome of menopause and you don't recognize that you need to be on vaginal topical estrogen and that you may need other
Mhm.
things as well. These are lifelong medications and where we've really failed kind of in the US on female sexual health. One of my really good friends and brilliant board certified urologist, Dr. Kelly Casperson, actually has this other awesome podcast, if I can sort of highlight it for female
Yes,
sexual health. And it's called You Are Not Broken. And she wrote this great book called Stop Shoulding All Over Your Sex Life. And it really talks all about that, about females and the orgasm gap and women and sexual health. And she really normalizes it in a really good way. So if you're a female listening to this, that's a really great
yes.
read.
God,
And
I
her
should see if she would do my podcast, because I
yes,
would
yes.
love that, because I am a firm believer that women just have to speak up, and men do. They walk around thinking, "Oh, yeah, I'm pretty good at that." I'm thinking, You've been lied to."
It's true, it's true. I sometimes get, questions, men will ask me, like, "How did you as a, like, female get into, like, men's health?"
Right. Why did you want to study the
And,
penis
I'm
so
like,
much?
I love men.
Yeah.
I have 3 boys, that I want to grow up to be strong, healthy men. And, I love how I can talk to men about something that's so intimate and so personal and make them feel really comfortable and
Yes.
normalize it. And then also not only improve their sexual health, but improve their overall health. And then I kid with them. I'm like, who are the majority of most men's partners are females, right?
Right.
So I'm invested. We know how to help. We know what to do. And so I actually think that it's a plus being a female in my field because I think I offer things that sometimes you don't find in other providers.
Sure.
I
That's
love
actually a complete side question, is what are some good things to, because I have a son, what are some good things to share or to talk to them about, even that's appropriate to talk to them about? They're not going to want to listen, but I'm good at just, okay, that's fine. I'm just going to follow you around the house, and I'm going to say it anyway so you hear it. So, what are some things that we should be saying to our sons that they probably won't be getting even from their father because they're embarrassed?
No, really good question. So, number one, age appropriate. We should start bringing up sexual health and normal things. Boys should know normal anatomy terms. You have two testicles, you have a scrotum. You can say balls, you can say nuts, but they
Yeah.
should know. They should know that those should be down in their scrotum. There's something called undescended testicles or retractile testicles where the scrotum or the balls come up into the inguinal canal and come out of the scrotum. And if they're undescended and don't come down, that's actually an increased risk for testicular cancers. Testicular cancers are the number one cancer in young men. It's rare, but it is a number one cause of cancers in men, young men. So checking their balls, like monthly exams, just like women should do monthly breast exams to make sure they don't feel a mass or a lesion. Um,
Okay.
you
God,
know,
I never thought about
my
that.
gosh. And young guys too, like playing sports and running around, you should
Yes.
never hurt there, right? You shouldn't have ball pain. And sometimes you can get something very sharp, very extreme, worst pain ever down in the scrotum. And that may be something called testicular torsion, where the testicle twists upon itself and it cuts off the blood supply. And sadly, even at my own hospital, every year we have some young kids that we have to do orchiectomies or removal of their testicle because they got a torsion and they were scared and uncomfortable and didn't tell anyone until it had been too late and it had been over 6 hours and the testicle died. And
Oh,
had to have
my.
the testicle removed. So those are common things for young guys. Just getting them comfortable of knowing you should have two testicles. They should be in your scrotum. You should check them once a month. And people are like,
Okay.
what am I checking? Just so that you know what feels normal to you, how it feels, the texture. I usually tell patients it should feel like a grape, right? When you feel a testicle, it shouldn't have pain. You shouldn't feel lumps, bumps. Also, this is a really good, important time for young boys and throughout to talk to them about bodily autonomy and consent. That no one should be touching them there or doing anything to them to their body without their permission, because sexual abuse occurs in young men as well. I think I read something once that was like 20% of all kids have been sexually abused before they're 18 or something, and it's
Oh,
usually people they know. It's not the stranger, it's the neighbors that y'all hang out with, it's the neighbor's son or daughter or son, like
mm,
so things, it's people we know or family members, god forbid. Just awful. So talking to them about, normal body anatomy, normal functions, and then age appropriate as they get older, you should be the one talking to them about sex and being safe and being smart and using contraception and STIs. Before they're learning about it from their peers, before they're learning about it from online or porno. Unlike when I grew up, where, it was what, when we had to look up a report, right? You go to a library and you look something up, or
yes.
now people have too much information. They have the internet, they have all of this wealth of resources, or they go to porn to look for porn. And, eh, unfortunately, in most pornography, things aren't replicated in real life, right? And it's not a
Yes.
good example of even erectile function. I'll have men still, patients come to me in the office and they're like, I'm having trouble maintaining my erection. And I'm like, okay, well, how long does it take you from point of penetration to ejaculation? And they're like, 20 minutes. And it's too short. And it's because they've watched some porno or someone's probably on penile injections or has an
Yes.
implant and they've started their recording and they think that they're supposed to go for 2 hours and that's normal. When actually in US males, the average like erection and point to ejaculation is about 5 minutes, roughly. So that's the US average.
Really?
Yes, yes. So if you're above 5 minutes, then you're above average, buds.
Wow. 5 minutes. Okay.
Time of sexual activity to ejaculation, point of penetration to ejaculation.
Do you know what it is for women?
That is a great question, and I don't know the exact answer for that, but it's a huge discrepancy and difference.
Yeah.
Want to say, we published, someone published on this, and it was presented at the SMSMA, the Sexual Medicine Society of North America. And I want to say the average of a female is either 12 to 18 minutes, but it is double what it is for a man. And
Sure.
so again, it takes longer. And that's okay. I worry, I don't want some female to hear this and be like, oh my God, I take 30 minutes, something's wrong with me.
Oh,
No,
well, of
nothing is
course,
wrong
right.
with you.
Right.
You got to be in the right mindset. You need to make sure your hormones are right. You need to make sure that you know what feels good to you. And sex should never, ever hurt. If sex is uncomfortable or it hurts, something is wrong. And we have treatment options. So please go see a urologist who specializes in female sexual health or a urogynecologist who specializes in female sexual health.
My mind has so many questions. I'm thinking, "Oh my god, I could talk to you for, like, hours, and there's so many other things." Um, okay, so I love all that information because I've actually talked to my son about the porn thing, how that's not reality, that's not, typically, that's not even what women like, you know what I mean? It's just not normal sexual loving relationships, so I'm glad you said that.
Yeah, and I think you bring up a really good point about like pornography, right? Because that's where a lot of people are getting their information and where they're seeing things.
Yes.
I think one of the biggest things that I get, because I also teach the medical students at our institution, and I sadly, most med students, most med schools in the country don't even get a sex ed education standpoint. And I give them their 1 hour lecture and their 4 years of training. Okay. So in general, most even medical professionals and doctors aren't getting sex ed teaching or training, right? So so we wonder why people feel uncomfortable bringing it up. Like doctors who are supposed to
Sure.
talk to people about their most intimate stuff even feel uncomfortable talking and asking about sex or porn. But porn. The other thing is really just making sure that you teach our both men and women that sex has to be consensual,
Hmm.
and consensual sex is not drunk sex. It's when both two parties are awake and consenting and okay with that. And like you mentioned, that what you see a lot of times in these fantasies aren't real and in these
Mm-mm.
videos. And the importance again of like getting comfortable and talking about it with your partner and talking to them in a way that they don't feel defensive, and that it's usually outside of the bedroom is the best time to talk to people about bedroom habits or things they like and don't like. But porno definitely, when you see these young generation and and older generation, they're watching it all the time, and it
Yes.
can lead to erectile dysfunction. It can lead to a lot of sexual dysfunctions by watching it too much, and trying to emulate. You build up this kind of refractory period, and then you also start to need more and more and
Yeah.
more to get aroused and turned on. And these things, you have a hard time replicating that arousal when you're with their partner or yourself. And so it can really become a damaging thing at times.
Yeah, it can definitely hinder things for sure.
That's not to say that like all porn is bad by any
Of
means.
course.
It
Of
can
course.
be great in couples that internalize it. It can be great sometimes for individuals as well, right? To
Right.
learn what do you like, what feels good to you, what erogenous zones are important to you. Give you ideas of fantasies that can help you reach climax and orgasm better. So it can be helpful, but also in the right
Yeah.
setting.
I think
Sure.
for exploring what your wants and your needs, I think that's a good thing. But yes, I think if you have to have it to fulfill, to feel good every time, I think definitely that could hinder any real sexual relationship you have.
Or if you're doing it in secrecy, right? Like you're doing it without
Yes.
your partner knowing, things like that. It can be.
Yes. Is shrinkage a real thing? Do you get smaller as you get older?
So, what happens? So, a healthy man, no. As most men age and get older and develop erectile dysfunction, the longer they have erectile dysfunction, the more you get something called smooth muscle collagenization. And it's where you actually get erectile tissue or corporal atrophy and fibrosis. And so, yes, the penis actually does shrink because you have erectile dysfunction. You have poor blood flow and vasculature in the penis. Think of it, it's not this simple, but think of it like a muscle, kind of a use it or lose it. When you're not using it, it will start to atrophy and fibrose. And if you are not using it because you can't use it because you have poorly controlled issues and erectile dysfunction, then you do get what's called smooth muscle collagenization, and that is where you will see penile shortening. You also, after men have surgeries like a radical prostatectomy, may initially notice that's where they remove the prostate, which sits just between. So here's your bladder, then you have your prostate, and the urethra, urine channel goes through that, and you pee. When we remove the prostate, we do have to reanastomose or reconnect the urethra or the urine channel. So initially, you do have this hyper kind of parasympathetic response, and you will see a little bit of penile shortening. Most data shows that at the 1 year mark, that's back to exactly where it was before the radical prostatectomy. But you do see penile shortening from that. And men that get Peyronie's or a curvature of the penis,
Yes.
it's where the body lays down this collagen fibers or plaque that lays down, and it shortens the penis. It can shorten the penis and cause bending and curvature or hourglass deformities, narrowing, tapering, many different shape deformities, but that can shorten the penis as well because the plaque is non-elastic. So for a man to get a natural erection, blood goes into the penis stretches. Wherever you have that plaque, it's going to pull the penis in that direction and it doesn't stretch. So you can see shortening there. If people have had injury or trauma to the penis, you can develop penile shortening. And then also gaining weight, right? The more weight,
Yes.
the penis is set anatomically where it is connected in your body. But if you gain more weight and now your abdomen sticks out more, men can get something kind of called turtling, where the penis kind of
Yes.
shrinks inside,
Okay. Well,
and it's due to weight gain and
well,
body
see,
habit.
I always thought that even though when they would have sex, that it would still be the same size. It's just you don't see it to the eye.
Yeah.
So it actually will suck up in there, and it doesn't. It's not the same size.
You get more obesity, you get more, central obesity or mons pubis adipose tissue, and it can cover and prevent the penis from, its full length and all that.
My God, I've learned so much today.
Well, I'm happy to talk anytime.
My goodness, this was so informative. I loved talking to you. I learned so much, and I certainly hope, that we can at least get one man to think, shit, I've got all of those things. And
Yes.
I thought it was just because I'm sure a lot of people are like, well, I'm just getting older. That's just how it is. But it doesn't have to be, is
No,
really what the
not at
bottom
all,
line is,
not at
right?
all. And in fact, there's a lot of this push towards kind of like, longevity and lifespan and your health span, right? Like, it's not just prolonging life, but prolonging life that you're able to enjoy and do the things you want to do, and you're healthy. And so again, taking charge of your health, those 4 pillars, right? Diet, exercise, sleep, stress modifications, and really optimizing your health so that you can enjoy sexual health and your sex span and all of that for all of your life.
Yeah, because gosh, I talked to you about it earlier and how I want women to, to still live a fulfilled life, and there's no reason why men can't too. I mean, we can
Absolutely.
live a full life with, great mental health and just being happy with our sexual health and living a full life till the end. It doesn't have to be, well, now I'm 52, I guess this is all over for
Yeah,
me.
not at all. Or I'm 70 and, oh, I can't have sex.
Yeah.
I kind of kid, but my grandparents are no longer living. But I remember when I was in med school and my grandmother was like, "Oh, we bought stock in Cialis. It's great." And I was like, "Grandma, I'm like, I don't know that." But like, how awesome is that? That like my
Right,
80-year-old grandparents were still having great sex
right.
and intimacy. Like, awesome. Like, go Mimi.
I mean, I like oh, that's what I call my grandma. I like to think that my parents only had it a couple times, but everybody else in the world, I want everybody else to be very happy sexually.
Absolutely. It's important.
Well, thank you so much for doing this with me. It was truly a joy. Thank you for joining me. As always, do better, expect better, and be better. And remember to laugh through it all. Don't forget to check out my Shopify page where you can pick up some do better, expect better, be better, and some laugh through it all merchandise. Link is in the description.